Good afternoon. It is hard to believe that we are now 50 days with our Emergency Operations Center open as Delta County addresses COVID-19. But I can tell you during that 50 days we have seen the best of all of our individuals in Delta County, as well as here locally, where all entities have worked hard to address this, to be responsive to individual needs, and to really put a plan in place that not only provides for that immediate planning, but helps us to plan for the surges that we know will come in the summer, in the fall, and into next year. So again, Delta County has been working hard, and we are prepared, and we continue to provide that preparation and resiliency for Delta County. Here at the county, we have been very consistent about that we want to provide the best information that we can for not only our individuals as they work through the testing process, as they work through how to manage around the COVID-19, but for our businesses as well. And so this week we saw the opening of our retail businesses. We saw the opening of our personal services. And again, the health department has just been so good about providing that consistent messaging that we get from the guidance from Colorado Public Health and Environment to answer those questions of how to open, how to provide the social distancing, how to provide the sanitation needed. And so with that, then, again, we've just been there consistently with that messages for our businesses, saying this is how we open Delta County, this is what we need to do to make sure that we provide the safety for our community. In addition to that, we have our Business Recovery Center, and our Business Recovery Center has been extremely busy. Not only did they provide immediate resources for individuals as they work through the federal system, whether it be for the Paycheck Protection Program, the Small Business Loan, any of the other federal programs, but as just as well, how do I take this time to look at my business and perhaps retool? What training have I not been putting into place that now I have some time to put into place? What do I need to do to provide additional information to my employees? Business Recovery Center has been there and holding weekly calls for all businesses across all of Delta County. And that has been highly utilized, again, by our businesses. Our businesses have found ways to work around and ways to work within, and they have been doing an excellent job. Delta County also set up a business loan fund through the assistance of Uncompadre Development as well as Region 10. Delta County Board of Commissioners put forward $250,000 towards Region 10, but it was specifically for businesses in Delta County, where we have the loans of $5,000 each for those qualifying businesses. Not only to provide that bridge between the local and the federal assistance, but just this continuing operation. We know all businesses have been impacted, not just the ones that were told to not open, but also the ones that were open, but there were additional requirements such as additional employees for sanitation, additional operating cost and that. And that's where, again, our business loan recovery came into place. To date, we have processed 12 applications through the entire process and awarded those 12 loans. We have additional loans that are in the process and being evaluated. Last night we heard that the City of Delta then put an additional $50,000 into this same loan fund. So again, Delta County has been there, and with the City of Delta with the dollars to help our specific businesses again with that transition. Again, I want to thank the health department. They have worked tirelessly and just gone above and beyond with the testing that they have been through and getting the supplies from the state, as well as just doing the tedious work of all of the nursing and the tracing. And on Nurses Day, we really want to call out the health department and thank them especially for all of their work. If it wasn't for the volunteers here in Delta County, we couldn't have been successful as the Emergency Operations Center. In Delta County alone, we had over 100 volunteers. Over 100 do everything that we asked them to do, whether it was hand out meals or run meals or make masks or make gowns. And it was just phenomenal. And we think about this pandemic across the United States. In a normal emergency, we could call on another area and be able to provide supplies, but we didn't have that luxury this time. And true to Delta County, we took care of ourselves. We took care of ourselves with the help of our volunteers. Our Emergency Operations Center is so pleased and so thankful for all of our volunteers. So to wrap this up again, we're concentrating on our businesses, we're concentrating on assisting those individuals to get through this period and answer questions. And I'm proud of the Unified Command. The Unified Command between the health department, the county, and the hospital is a model that not every county has. And it's a model to make Delta County proud. Thank you.
So I want to speak. I'm Jody Rover. I'm the Chief Clinical Officer for Delta County Memorial Hospital. And I would like to reiterate many of the thanks that Robbie has shared with the county and the community. But I'd first like to thank all those people on the front lines. Today is May 6th, and May 6th through May 12th is National Nurses Week. And all of our nurses, they are always willing to put themselves at risk for the sake of others. And this is selfless work, and in the past several months, the hospital has had a lot of low census, so many of these nurses had minimal paychecks, but when they were asked to come to work, were expected to work with very sick patients that could potentially infect them if they should have a contact. So I really want to thank those people on the front lines, and even though it's Nurses Week, there are many people on the front lines. All the people that check you out at the grocery store and at the different businesses that have been open, all the people on the ambulances, and honestly, anyone that is still been asked to continue to greet the public, they have been wonderful, and we appreciate all of them. But today I want to especially thank our nurses. I also want to say that please continue to believe Delta Hospital and our local clinics are there for you. We continue, even though time is passing and it seems like our emphasis is not as strong over time, I want you to understand we are still taking all the precautions necessary to keep our staff safe and to keep anyone that's a visitor safe. We are meeting regularly to continue to devise plans for the future. Our outpatient physicians met yesterday, and they discussed the need to continue to keep separate entrances, separate waiting areas, and this may be a forever change. We are prepared to look at our clinics and say, is this something we need to do forever? And I think that's one of the things we all need to do throughout these kinds of crises is look and reassess what needs to change that will be changed forever and that will really make an impact on the future. So those are some of the things we are looking at as healthcare providers. So it is safe to go to your medical clinic. You will go through a separate entrance from people who have respiratory illnesses. And it's also safe to come to the hospital, to come to urgent care, to go to the walk-in clinics, and to go to the emergency department. We are using all precautions necessary to keep our environment as safe as possible. To date, we have only had 2 positive COVID patients in our hospital. We have had multiple, what they call PUIs, people under investigation, but all of those people, when tested, have been found to be negative. And only 2 positive, and both of those people spent really a relatively short period of time in our hospital. One of them 48 hours and went home. So we've been incredibly fortunate in Delta County that our population has not been hit any harder. And all we need is one outbreak among a fragile group of people, and those numbers will change quickly. So please know that the hospital supports the reopening, but we have to still be smart. We have to still keep safe distance. We have to, I want to remind you about the reason for masks. I hear people say the masks are useless, but we have data that encourages us to wear masks. And you need to remember, this mask is not to protect me. It does nothing to protect me. It's to protect the people around me. Because it's just like putting your hand up when you sneeze or you cough. Except now we know when people speak, there's a certain amount of saliva that leaves their mouth and can travel up to 6 feet away. So this keeps us from being able to contaminate other people. So that's the reason for a mask, and I would still encourage people to wear masks when you're in public, because we know there are people that are asymptomatic, that don't have symptoms and are positive. And this is the way, if you care about your community, wear a mask, please. Thank you.
This is Karen O'Brien from the Delta County Public Health. And first of all, I want to thank every individual that might be listening in. I think it was really a tough haul, the stay at home. And I really appreciate everybody that took part in taking individual responsibility. And it really worked. It really helped us so that we had time to build up our supplies, to build up our process, to build up everything that we needed to do in the event that this comes back and hits us harder. So I think that was a really great move on everybody's part to really adhere to a lot of those the guidelines that were in place. And it was successful. Our hospital's not overwhelmed at the moment, and our cases of COVID have been manageable to this point. As we enter this next phase, it's called the Safer at Home phase, we'll be emphasizing more businesses to open. There'll still be guidelines, there'll still be 6 feet of social distance, and as Jody had said, masks, face coverings, gatherings of 10 or less, staying at home when you're ill, and washing your hands frequently. All of these things have a profound effect on keeping our community safe. Some of the things that the health department has worked on over the last month, it's hard to believe that on April 2nd we had our first case of COVID in Delta County, and now we have 52 cases. The good news is we have about 27 people, and it's rising. We've recovered, and that is partly because we're able to get to these cases as soon as possible and get them isolated and their contacts quarantined, and watch them and keep them under observation, and so that they don't get more ill. Just a little bit about contact tracing. Each individual right now, there's been about maybe 3 to 5 contacts for each case that we've had. So not a huge amount, and that says to the fact that everyone's been keeping their social distancing down and their contacts pretty minimal. As we enter this new phase, though, that's going to change as we mingle more and we shop more and all of that. So case contact tracing will be a lot bigger. Perhaps there'll be up to 10 or maybe more contacts that we'll have to follow. And the whole idea behind following that is so that we could get at this quickly as possible. If somebody is exhibiting symptoms, we want to get them in for testing as soon as possible, and then be able to contact all of the people they've been with so that they can quarantine themselves so they don't spread it to other people. So this will become very, very important, even what's always been important, but even more so as we start mingling more in the community. The health department received the first testing supplies back in mid-April, and that's something else that has been really, as Robbie had said too, initially, we were all alone. We had no supplies, hardly any supplies, and hardly any guidance on things to do. And we've received those supplies now, and we've started testing. We at the health department have tested around 65 people so far. And the beauty of that is that we're able to get them help or isolate them as quickly as possible. The other thing that happened in the last month is the symptom tracker. It's an online tracker for you to go online and take a little survey about the symptoms. And maybe you haven't contacted your personal care provider, and if it's not, if you're not that symptomatic, but you're curious as to what that looks like, you can go online and fill out that form, or fill out the tracker, and then that information is fed back to the health department. And if we find that somebody is symptomatic, we'll call them and follow up with that individual, and then try to get that individual tested. One of the other areas I wanted to highlight, we talked a lot about Nursing Week, and the nursing homes in particular. I want to thank all those people that have worked in the nursing homes, because that is the major source in our state for outbreaks, and we have to say that they have been doing a phenomenal job, and we really appreciate that and continue to do that. We have a public health nurse that has been reaching out on a daily basis and talking with the staff at each of the nursing home and assisted living facilities. And I think this has really been important to develop that rapport, and they know who to contact for help. And we can also get their residents and patients in for testing as quickly as possible. So a big shout out and thank you to all of them. And the last thing I have is on the business plans. I really thank all the businesses that have sent in their business plans to us. And it's not that we have to approve them or anything, it's just that we have them on file. And with the unfortunate case of having employees perhaps that get ill or maybe get tested positive for COVID, we have your business plan in place so we can see, what kind of guidance you've been giving, and maybe adjust that guidance a little bit and just be able to help out the business so that you don't have to close. So I know that's been very trying for a lot of people, and we're trying to balance the economy and trying to balance to keep everyone safe and well, and that's a big juggling act. And all we can say is we really appreciate your cooperation. And the last thing I want to thank is really the call line volunteers. We had our call line in operation since early March, and they have done a phenomenal job in answering everybody's questions, and that is a hard job to do. So I really appreciate them, and thank you.
We just want to end by, there's so many people we need to thank, and we will thank everyone, and we will thank everyone with the appropriate measures that are safe, and we will do that at a later time when we can celebrate, and we will get through this, and we will celebrate, and we will thank everyone, and we will thank them in person. And I just think about, we have 2 National Guard people that have been here, Major Wilcox and Sergeant Tim Kirsch. They've been here since April 6th, again, helping us with our plans. And Chris Stewart, who has been here literally night and day as our Emergency Operations Center, and he's led the helm, and he's kept us on task, and he's been diligent about making sure we provide for supplies that are just scarce, they're just not available, and he's been diligent there. And so again, the list continues, but we will celebrate. We wanted to end by telling you that Delta County is going to put forward a request to the state for a variance. And we're very cognizant of the fact that our number of cases continues to increase. But we are looking at the spacing here in Delta County as far as the restaurants and the churches and that, and we believe that we can build a variance plan that still falls within the guidelines of social distancing and that, but really starts to address, again, our economies and working through that. And so we'll be submitting that as well from the county. But understand that's a process that goes to the state, and that's a process that will be approved or negotiated by Colorado Department of Public Health and Environment. So that is not anything that happens quickly, but Delta County will be putting forward that. But again, we want to end with this update by just saying thanks to our PIOs. They have been also so tirelessly working through all of this and putting out information, and I know they get beat up on the social media, and we wish we could take that away from them, but they have been so good to respond and just continue to put out the good information, the solid information, not any of the information that takes one side or the other, but just the solid science information, and so we want to thank them. Again, thank you, Delta County, and we so appreciate everything you do. We are here for the long run, and we'll continue to be here. We've got many more days ahead of us, but thank you for what you've done up to date. Thank you for what you will do, and we will get through this together. Thank you.